feel like if I didn't make changes, who knows what would have happened. I feel like I'm lucky because I didn't have a stroke or didn't die after giving birth. That's how I'm just so thankful for this program because I get to live now for my 2-year-old.
As we learned in part one of our Human Resilience podcast about Mom's Heart Matters, the continuity of care for patients like Tony Smith is optimized when there is a methodology for personalized care delivery that adjusts in real time to a person's mental, physical, and social needs. Along with Dr. Callens, the visiting OBGYN, and Heather, the superb nurse and care coordinator whom we met in our first segment, let's meet Dr. Abisigan, the team's cardiologist.
Thanks, Shell. One of my favorite expressions is you don't know what you don't know you don't know. And this journey, what you'll hear in part 2, is about helping moms who may have come from tough, stressful, and broken family environments to unlearn, to learn, and practice being emotionally and physically healthier and happier. And that is not necessarily an easy task to accomplish.
There are times in the world and life when a discovery changes how we do things. Hi, I'm Shelley Schoenfeld. Join me and my podcast partner, behavioral technologist Bob Gold, on this journey of discovery as we unfold a whole person health delivery science for people in need. Welcome to Human Resilience, changing the way healthcare is delivered. Hinesville, Georgia is in Liberty County, one of the 159 counties in the Peach State with about 35,000 residents. Hinesville is home to Liberty Regional Medical Center, where approximately 50,000 patients are seen yearly, nearly 30,000 of them in the emergency department alone. This program you'll soon hear more about is helping Liberty to deliver proactive, engaged, personalized care and decrease unnecessary emergency department visits and readmissions. Let's find out more about Liberty's team and hear from behavioral psychologist Suze Bukowski, who helps us understand the hormonal changes that occur for new moms and how they impact mom's psyche and overall health.
What's critical is when a woman is pregnant, she has immense hormonal changes that can affect her overall physiology, prepare her for childbirth, and allow her to bond with the baby. All of those changes are critical for successful childbirth, but with that change also can come changes to the brain chemistry, which can result in postpartum depression. That's further exacerbated by the fact that women often don't have the skills that they need when, of course, they're delivering their first child. So we are all unexperienced as parents. And we may not necessarily have the social support network that is needed to help a woman to be successful as a mother. When you start combining those environmental factors with the physiological changes, that becomes a recipe for where you can have changes in emotional well-being, postpartum depression, and other challenges.
Our journey started a couple years ago. We noticed that we were having our postpartum moms coming in as patients. We were having moms come in and complete heart failure. We were having moms come in and congestive heart failure. And we're like, why? How can this be? We started making correlations way back then and noticing that there had to be a relationship between postpartum and pregnancy, high blood pressure, and cardiac disease and potential heart failure. So we started noticing the trend, noticing the relationship, and then we were able to get together and start offering our patients cardiac follow-up. Any of our moms that had high blood pressure or any blood pressure issues postpartum, we would start having them have cardiac referrals with Dr. Abisigan. After we started that, Dr. Callens joined our team, and she approached me one day in the hallway and she said, Heather, y'all are the only hospital I know of that does cardiac referrals for your moms with blood pressure issues. Can we elevate this and maybe add to that? She's like, I have a couple ideas and let's get together. And we invented MHM that day in that classroom over several hours. And in our minds, we were going to save the world with our MHM program.
That's an awesome story. And by the way, you are saving the world because they save the world by saving one life at a time.
I want to talk about the value of divine providence, probably is the best place to start. In preparation for that, I really dug deep and attended a lot of seminars and really started to embrace the importance of how we address postpartum issues as it relates to cardiovascular disease. And then it just so happened that my mentor, who is one of the staff members here, OBGYN at Liberty, asked me if I would come to help. And I said, well, I am not really trying to work on the weekends, but I will give you one weekend a month. And so with that was able to join the medical staff. And I remember sitting at the desk the first time I remember this and seeing Dr. Abisigan's card taped to the counter and realizing that they had that opportunity to do a direct referral for a cardiologist. And I thought, well, that is the coolest thing.
I'm an interventional cardiologist. So what we focus on is the hemodynamics, blockages, whether they have stenoses, whether you need a stent if you have a heart attack, things like that. So I think of myself as a plumber. Women have a whole host of issues that they deal with during their pregnancy and right after pregnancy. Peripartum cardiomyopathy is actually a big one. That's when your heart muscle actually weakens, it gets a little dilated, and instead of pumping like a strong pump, it pumps very weakly like a big sac. A lot of these issues are genetic. There's certain populations that have some predispositions to it. Another issue that's a big one is hypertension during pregnancy. Preeclampsia, which is kind of an extreme case of that during pregnancy. During the pregnancy and right after the pregnancy, that can cause a lot of complications, including loss of the baby and loss of life for the mother.
I remember checking my blood pressure at home and debating whether or not if I wanted to go to the hospital. But I think if new moms, even old moms, you should listen to your body and just go to the hospital if you start feeling bad. Because what if I didn't go? What if I just stayed home and suffered through it? It could have been a really different story by then. I did try to go to another hospital first, but they sent me home with a Lasix pill and said, follow up with your primary care. And I was like, this isn't good. And then the very next day I was like, we need to do something else. So that's why I ended up going to Liberty.
Yeah, and I think what you're saying is if you didn't get the messaging to clue you in and you didn't get a schedule routine, you didn't take your blood pressure, you may have sat home and maybe had a stroke or heart problem, or it could have ended up with an adverse event, right?
I see other women who's given birth and end up having strokes and they have to go to therapy and they're trying to relearn to walk, relearn to talk. And, that could have been me. And thankfully it wasn't because I followed my primary care, my cardiologist and Heather. And I'm glad I just had that support behind me. So I'm able to live functionally and healthy for my son.
Change happens at the speed of trust. And one of the things that I think we are able to do with that initial kind of monitoring period is we are establishing a trust relationship with the patient. And trust is interesting because sometimes it's equivalent to sometimes you're building bridges, because their previous interaction with the healthcare system has not been pleasant. So sometimes you're building bridges, sometimes you're repairing bridges. But I think what we do with our patients in that initial period sets the tone for a non judgmental, reliable information exchange.
The whole point of the program isn't just to let's monitor your blood pressure and make sure your meds are holding you. The whole point is to better help that mother be healthier all around. The main way you are going to change your blood pressure and ward off bad things happening is taking your blood pressure medicine as you're supposed to, changing your lifestyle. Your diet is so important. It has such an impact on blood pressure. So if we teach them, Mama, sodium is really bad for your blood pressure, it will act against you in your efforts to make it better with this medicine and doing what you need to do. Watch your sodium, watch your diet. Exercise helps as well. So we give them all these tools to help them make a lasting impact on their health and their ability to themselves make a difference with their blood pressure. If we give them the tools to help themselves, that's all they need. They can take it and run with it. And that lifestyle change in the end will last with them for years and years and years.
You know, Heather, you're so right. In my science of, human motivation, activation, resiliency, how do people even know what to practice at home? Like, I'm a first time mom. How do I be a parent? How do I breastfeed and what makes sense? And to your point, I didn't know sodium was adding to my blood pressure. And these are all things we put in the messages, the same things you would tell people.
We had a mom that was enrolled at postpartum discharge into our MHM program into the blood pressure support track. She had very diagnosed with preeclampsia, had bad blood pressure issues, and she was on medication when she went home. Well, we were able to see her in real time at home because she was taking her pressures as she was supposed to. And we saw that her pressures on day 4, I believe, was out of control. They just shot up sky high. So I immediately contacted her mom. What are you doing? Have you been able to take your medicine? Oh, I'm on the way to my child's pediatric appointment. So, well, Mama, your pressures are really bad. Can you take it again for me before you leave the house? Well, of course, it was sky high. It was terrible. Contacted the doctor. He was like, she has to come in immediately to the hospital. We need to retitrate her, get her on a new med regimen, and get her more stabilized. So I texted her, I said, Mom, please find somebody else to take your baby to the pediatric appointment. You really need to come in. You're in hypertensive crisis. We need to get you back to where you need to be, retitrate your medications. We'll put you on a new med regimen, but we need to stabilize you. And we do not want you to stroke out. That is a main concern. And so she fought me. She didn't want to, well, I'm busy. I'm going to go take my baby to the pediatric appointment and then I'll find somebody to come watch my baby and then I'll come in. I was like, Mama, this can't be 8 hours later. We need you to come in. Please come in. So I begged her and begged her. And finally she's like, okay, fine, fine, fine. So she found somebody to watch her baby and she came in. And that really made a difference. We were able to retitrate her and get her on a new med regimen. If we did not have that follow-up, she would have been in that pediatric office with insane blood pressures, feeling like death, thinking that she's just tired because she had a baby and she's been running 100 mile an hour. And, everybody makes excuses. Oh, I just feel this run down and this tired because I'm up all the time with the baby and I'm always got 500 things to do and I'm just running too hard. And you're supposed to be tired when you have a new baby. That's expected.
The benefit of this whole system is that we can identify when patients are having trouble. We're not constrained by a physical building or a patient's ability to get to that building. Not everybody has a car, not everybody has gas to put in the car, et cetera. There's a lot of social determinants of the healthcare that people are constrained by. And when we have these programs where the patient, they can check their blood pressure, we can see that the patient's blood pressure is elevated. Heather will text me or call me periodically, and the patient will have a blood pressure of that's very high, like 180 over 100. They'll be postpartum. And the challenge is, okay, now I have that information. How can we help that person?
From the provider side, some of the stress they have is there's not enough providers, nurses, doctors, and they can't be with you and walk around with you in your daily life, but they wanted you to do the things you just described, like get into a routine, exercise, but they can't be with you at work, home, and play. But in essence, with Mom's Hearts Matter, they were, right?
Exactly. I had someone with me every single day.
By the way, when you were getting the messages from Mom's Hearts Matter and they were telling you the things that you described about wellness or mental health or parenting, breastfeeding, reminding you about the blood pressure, did you share that with others? Because a lot of other people don't get that from their doctor, they don't get that from their professionals. I'm just curious if you said to your friends, look what I get.
No, I did. I was part of a MOPS group. It's Moms of Preschooler Children. So I would meet these moms every Sunday after church and we would talk about different stuff. And I remember just sharing that part of my journey with them. And there was like 20 other moms in the group as well. And some were pregnant. And that's not something none of them has mentioned they've received either. So it felt like I was the only one getting this care or received this care and they have not. It's kinda sad seeing that it wasn't available to them.
Well, we're on a mission, not only with Liberty, with Georgia Family Connection Partnership, Georgia OBGYN Society, the Morehouse School of Medicine, to expand the program not only across Georgia, but across the United States.
I have been told by both my primary care physician and my cardiologist that I'm the perfect patient. I did everything that I was supposed to do, and I actually don't have to see my cardiologist for 2 years, which is sad. I really like him, and I'm bummed I don't get to see him for another 2 years. So I don't feel forced, like a forced relationship, like some of those relationships you get with your primary care physicians and stuff like that. It's just a genuine, I feel like, friendship with my cardiologist. And not everyone gets that, but I got it with Dr. Bisagun.
It's a very fulfilling career. And like I said, I'm a plumber, I'm an interventional cardiologist. So, what I do, if someone has a heart attack in the middle of the night, they're dying of a heart attack, you come in and you open the artery and hopefully you preserve that person's life. And that's a high and that's a rush that's hard to describe. It's amazing. That being said, I think the thing that gives me the most joy is sitting down with a patient and a family and having them really understand what's going on with them and taking the time to explain what exactly the medical issue is and why it's important, and having them say or feel, I've had this for 20 years, but I never even knew what it was. In a way, that is even a higher high than the instant gratification of, doing a procedure and getting a good outcome, just making sure people know what's going on, which unfortunately, a lot of times they don't. And I think as healthcare providers, the onus is on us. We have to educate. That's our job.
From our initial launch of February 2023, we've had 122 moms enrolled. For data of just 2023, we had 21 moms enrolled in the BP support track. 11 of them had to have med intervention remotely. We were able to call in the new med management plan to their pharmacy. They were able to go pick it up and start it that afternoon. 4 of the 21 moms had to come in for retitration and stabilization into the hospital. We see that there is the need. It absolutely works. We also had 57 moms enroll in 2023 in just the postpartum support track. We caught 2 moms that were flagged for postpartum depression with the escalations in the postpartum support track. And so we were able to immediately contact them and get them the help they needed, and they're doing wonderful now.
I'm a behavioral psychologist, not a not a neuroscientist. But your body does release hormones that allow you to, in fact, bond with the child and gives you this incredible sense of love and connection. And likewise, that can also change other things in terms of your brain chemistry. Women can have an incredible high around feeling connected with the baby, but also extremely lows with respect to feeling alterations in their mood. And that's where you see postpartum depression occur in women. And that is further exacerbated by a sense of where you feel guilt over those feelings that you're having, where you feel like you should bond and immediately feel connected with your baby. But instead, you feel withdrawn, depressed, unable to engage.
What we do initially makes a big difference. Are we providing respectful care? Are we providing dignified care? And does everyone have access to that same thing? But mostly, we want our moms to be present and healthy, to do what they do best, which is take care of their family. Mom's Heart Matters is an example of how you can really elevate and upgrade your level of interaction with your patient, and how it's a team-based approach. And it's not just on your shoulders.
The level of human care and combined with Mom's Hearts Matter help demonstrate your trust and credibility and form that intimacy where people are more likely to respond. In my field in cognition and behaviors, there's like 8 factors in believability, and the 2 most important are trust and credibility. So trust is you will not put me in harm's way, and credibility is you'll further my cause.
Absolutely. And the last thing I'll mention that I think I need to acknowledge publicly is the role of your administrative leadership support. because you can have concerned staff, concerned physicians that want to do great things. But if the administration is not interested or does not prioritize your concerns, then you really can't move with that. And so, one of the things that I think is unique about our hospital here is we have had so much support on every level and excitement. And advocacy happens on all of those levels. And as physicians, our advocacy is not just at the bedside. It happens in the places where decisions are being made, and it highlights the things that are important. We're a small hospital and we do have kind of a unique community setup. But I would like to say if we can do it, anyone can do it. When women dazzle, everybody shines. That's kind of my guiding star. And I love and appreciate every opportunity that I get to really instill that into the universe.
Shelley, the retention rate for the Mom's Heart Matters program at Liberty Medical Center is an astonishing 95%. Additionally, via GOMO real-time digital engagement, 23% of the participants had early identification of urgent need for hypertensive states and depressive states, so they were detected early and escalated to Heather, the nurse, that resulted in saving lives, avoiding strokes, and avoiding unnecessary visits to the hospital. Not only has it helped the patients, but it also has brought back smiles and joy in practice to the healthcare professionals at the hospital, as they're having a greater impact on the lives of their patient population.
Bob, those stats are really off the charts, and here's a few more. 100% of participants were extremely satisfied with the program's interactive tools and content, and every one of them shared they would recommend the program to other postpartum moms. Thanks very much, Drs. Callens and Abisagan, Heather Daniels, and Tony Smith. Truly a healthier and happier former patient. Shout out too to Drs. Bukowski for sharing the psychological lens into the postpartum mindset. On behalf of Bob Gold and myself, thank you all for listening to this concluding episode about the Mom's Heart Matters program in our podcast series, Human Resilience, Changing the Way Healthcare is Delivered.